this was different. This was like legitimately, there's so many controversial topics, and that was new. That's a heightened sense of sensitivity. So then I started digging in, what was it? And that's a heightened sense of sensitivity. So then I started digging in, what was it?
Hey guys, welcome to another episode of KLF Deep Dive. I'm really excited to have with us Edye Edens. The topic we're discussing is how to get maximal funding as an AMC. We still haven't figured out the name for this series, so now is still the time to actually help us choose the name.
Yep.
But we're really excited. Edye, why did you think this was the right topic to discuss right now?
So great question. So when I started this campaign and had all my various reasons, which we covered in a different video for doing so, I started reaching out to all of my colleagues who are in academic medical centers, going, what's hitting you the hardest? What problems are you facing? What would you talk to me about? And inevitably, every single one of them, the first thing they said is this on the record? It was like, I have to be very careful about what I can talk about right now and what I can discuss publicly. Now, to be fair, academia always has a certain element of that because there's, politics to be had, but this was different. This was like legitimately, there's so many controversial topics, and that was new. That's a heightened sense of sensitivity. So then I started digging in, what was it? And it had to do with access to funding. And it had to do with knowing that, look, with a lot of the presidential administration changes to NIH budgets, to funding, to our entire ecosystem, the academic medical centers are already very nervous and concerned, whether they are proponents of this change or not. But you're now seeing politics have a front row seat at some of your major academic medical centers, because to be fair, they're state institutions. And depending on what your state you're in, and depending on that particular political environment, there may be even more restrictions on your funding or the types of research that are going to be acceptable at this point in time for your organization to be conducting. So this can be a very quick pivot if you are a C-suite level executive who is trying to keep not just your operations, your processes, your patients safe, the FDA happy, all the things you do on any given day, but you're literally trying to run a large organization that's doing constant millions and millions of government funded research. Well, if the funding goes away or the conditions for the funding go away, that changes your operational workflow. It changes what departments you can fund. When you're talking about it inside a human research protection program, when you're talking about it, let's say at an IRB or a conflict of interest office or a research misconduct office, that's different. That's not an area that has had a funding switch that is related to government decision making the way we've seen this particular year. How academic medical centers fund all of their in-house enterprise-wide compliance mechanisms is deeply impacted the more you cut government funding for research. And so at some point, their overhead, if you will, isn't fluff. It really is how they pay their people. And you're starting to see layoffs. I mean, you're not starting, it's happening. It's been happening all spring. A lot of your academic medical centers are being very quiet about it, which I understand. Nobody wants to have to broadcast this. It's a really tough situation to be in, but it is dramatically changing the persona of being in our industry in academia. Very quickly, how many folks were like, I just cannot talk to you about what I'm actually facing right now. I have to be so delicate about it because it could be perceived that I'm speaking against my administration, and I'm not. I'm between a rock and a hard place.
Enjoying our content? We'd love to hear more. Please like, comment, share, and find more.
So I have to ask like a really basic sort of checklist, if you will. Give me the top 5 things that will decide how you get funding right now if you're an AMC.
Yeah. So I think coming from this lens, first and foremost, you've got your topics of research that you're not touching, right? So I think procedurally, as a program, like we've seen such an anti-DEI stance, right? That
Yeah.
if you're just operationally from an employee perspective, not
Yep.
even the actual research nuance workflows, if you are, I mean, we're seeing it in academic institutions, if you are supportive, if that's the culture, then
That
that's
might
going
come
to
back
catch
to
you off.
burn you. So that's
Yeah,
2.
I think it matters who, and I hate to use the word because I know you're gonna cringe, but key opinion leaders. I think it matters who yours are and where they
Oh,
position themselves politically. I hate to
Ooh, that's
say
a
it.
great one. Yeah.
I hate to say it. I don't want that to be true. I want key
Yet
opinion
it
leaders
is.
to have, but it is. So
So
I think if you have, if your institution or organization is known for research in therapeutic area A, and your key opinion leader in A, who everybody knows is associated with your institution, is also an extremely outspoken Republican versus extremely outspoken Democrat right now, that's a game changer. What is, if you're a state organization, so if you're a state academic medical center, state university, what is your relationship with your state government? Have you been outspoken in being a very, because some schools get to be known for being a little liberal, even though they might be in a red state, and vice versa, right? Everyone has their own sort of bend and their own environment and culture. So have you made fences and in runs? Are you, as the president of your organization going to the governor's ball, if you catch my drift? Political administration is now taking a front row seat in some of these conversations at different state funded organizations, going, look, you're state funded. You're not free and clear. You're state funded. And yes, we want to give you all your academic freedom and a long leash to explore all of the wonderful things that we want in academia, but you're state funded. Don't forget it.
that's four. What's your fifth one? The last one. This one matters.
I know. And of course, you never asked me this till we're on site. I'm like, man, what would yours be? Give me one.
Ooh.
Give me one.
Ooh.
I'm turning it over. Let me think here. I was gonna say, because there's plenty. There's absolutely plenty.
What
But
you
you're gonna
got?
think of one I wouldn't think.
No. See, this is why you're the expert. Give me a couple of choices, and I'll pick one.
Okay, so I think the other thing that this could bring to the surface as a boil, and honestly, it might not be a bad thing. Could we have more regulatory efficiency? Is there an argument to be made by the
Ooh.
current administration going, look, you've been allowed to wrap yourself in red tape, in red tape, in red tape, in red tape, in red tape. You really never did need this much for your IRB, for your HRPP, for your regulatory. We're not
I love
suggesting
that.
patient safety isn't paramount, but you could have been doing it. Look, it's like the Doge approach, right? Like you could have been doing it more efficiently all along with less, and you didn't. And so we're trimming your fat.
Oh,
We
that's
didn't
a
do it for you.
great one. That's a great one.
That's the
I
other
love that.
one
I'm
I'm
going to read
thinking
that out for everyone. We had topics of research. We had your DEI stance. How does your KOL look, if you will? What is your relationship as an institution with the government, with the state government? And then a really good one. I did not see that come out of left field. Regulatory efficiency. I love that. We can get into this and many, many more topics.
Oh, yes.
But we're going to keep it tight. We're going to tell you that if you want to know more, if you want to find out what else was on that list, we want to know number 6 through 10. You got to reach out to Edye at kulkarnilawfirm.com.
We have secured speakers, and I'm going through these topics with actual administrators who are at academic medical centers at this point in time in very different settings and in very different topics. And so that's where we'll get into that 6 through 10, because I want you to hear it from their lens. That was the whole point, is to really learn and talk there, right, with the experts experiencing it.
I don't know if you guys caught this, but I did. We might have to be the ones telling you about 1 through 5, because the truth is they can't touch it. They can't tell you, but we will. We're the ones listening to what they're saying, and we can help tell you this is how you need to position yourself so that you can maximize your returns. But stay tuned. Go to klf.com. So that's www.kulkarnilawfirm.com, and sign up. And you got to hear Edye talk, because she's got a lot of opinions. So thanks again, everyone.
Thank you.
Call, click, or email